Our hospitals, both private and public, are already close to full capacity in a number of provinces, and ICU beds are either full already or rapidly filling up. That's according to President Cyril Ramaphosa. Joining us to discuss the burden that frontline workers continue to face is General Secretary at NEHAWU, Zola, Saphetha, as well as former President of the Health Professionals Councils of South Africa, Dr. Kgosi Letlape. Gentlemen, a very good morning to you. Thank you so much for your time. Starting with you, Dr. Letlape, give us a sense of what you made of what the President had to say last night, especially looking at the strict measures that have been imposed under level 3 of the lockdown.
Good morning to you and the viewers. I think what the President announced is most welcome, given the rising numbers of cases of HIV and AIDS and the new variant that is more infectious. But I hope it will be augmented by society cooperating with the new regulations, because the regulations on their own will not stop the virus. We need to behave accordingly. But since we are people that do not comply easily, it is most welcome that it is now mandatory for people, for all of us, to wear masks when we are in public, and that gatherings have been curtailed.
And let me bring in Zola Saphetha of NEHAWU. We know that healthcare workers have been the most vulnerable and heavily exposed. In fact, we listened to the President read out a tweet from a doctor who spoke about this really serious impact on hospitals, and half the staff, he said, within a certain hospital were affected and infected with COVID-19. What did you make of some of these stringent measures that were announced?
Good morning, Paul, and the viewers and the doctor. We welcome the approach of government of protecting the health of our people, while also protecting the people's jobs and the livelihoods, which is a critical point that we want to make. However, we do hope that the announcement made yesterday will at least ease the pressure that our members and frontline workers in particular have been confronted with, given the fact that at least there will be no consumption of alcohol for that period. And we pray that should have a positive impact on the strenuous pressure that we work under. But of course, agreeing with Doc that that would require a society to adhere to those regulations, but at the same time, we need together with government, provide educational programs that will make society, because we need to win society on our side, so that themselves they take full responsibility individually and collectively. But of course, also expect that the enforcement of those regulations would really be felt, because regulations alone, without also taking along the society, would not necessarily make any significant impact.
You speak about the alcohol ban, and we know that the President spoke about the impact of excessive alcohol consumption driving up the number of trauma cases in the hospitals. Just give us a sense of some of the ways in which healthcare workers have been dealing with the alcohol cases and the number of unavailable hospital beds as a result of excessive alcohol consumption.
In our experience, alcohol has contributed to the main two issues. Firstly, the stabbings. When people enjoy themselves, as a result, they ought to come to hospital in numbers. As you know, that the time now is the time where people normally enjoy themselves through alcohol. As a result, they fight among themselves and they lead to stabbings. And that has put a serious stress, a strenuous pressure to hospitals, because people would have been given beds, and on the other hand, when they contracted COVID and were in a severe situation, would not necessarily be able to be accommodated because beds would have been full. And also the car accidents that are taking place because people are driving under the influence of alcohol, so they are unable to control the cars that they drive, because most of the cars are too fast and the technology now. So as a result of that, as and when people are coming, we will not have enough space to accommodate those who are really critical as a result of the COVID-19, but at the same time, we have to attend to them. So that's the general experience that we've been encountering.
Let me turn to Dr. Letlape. So you were speaking earlier on about the importance of behavioral change, and of course we link that now to the alcohol consumption and the consequences of this. Do you believe that these measures, especially the alcohol ban, will now alleviate the pressure on healthcare workers?
Yes, we think it'll go a long way towards protecting the healthcare system. But remember, it's not just protecting the healthcare workers, it's also protecting all of us. Because it's not only health workers that get infected, it's not only health workers that die from COVID. So we should remember that the issue about alcohol is an aid, but the fundamental issue is about the basic non-pharmaceutical interventions of physical distancing, wearing your mask at all times, and hand washing and sanitizing. So families should really go into their bubbles and maintain that bubble. Those that you've been in contact with, those that you live with, that's the way this festive season should be. Your other relatives, communicate with them with other means, but do not make huge gatherings. Remember, alcohol removes the inhibitions of people. So even when they come together, they will touch, they will not remember to use their masks, their behavior becomes unacceptable. So it's a combination of factors. We can't just say because something has been done about alcohol that we forget that the ultimate thing is that COVID doesn't drink. COVID just requires close contact. So it could move from one person to another. So even people that are sober, if they do not adhere to physical distancing, wearing of masks in public, and sanitizing and washing of hands, the numbers will still keep going up. And we hope that the measures that are being done around alcohol would be something that we would look at long term. The issue of alcohol is an ongoing problem every time in the year. Every December, even without COVID, we run into these problems of the healthcare system being impacted upon, running out of blood, etc., etc. It's time we did something definitive about the marketing, practicing, and the advertising of alcohol and the promotion and the celebration, especially by sports teams, celebrities. We need to curb the marketing of alcohol.
With this ongoing problem, Dr. Letlape, do you now believe that the alcohol ban should be extended beyond the 15th of January as announced by the President?
I think we need to look seriously into how we interact with alcohol. Long-term, banning things doesn't work. But as we've seen in other problems with tobacco, with the Framework Convention of Tobacco Control, reducing, banning marketing, advertising, sporting endorsements has come a long way to reducing the incidence of smoking from greater than 50% in most societies. And in those that have done the measures, the prevalence of smoking is around 15% or way below 20%. We need to look at those measures long term. As we know, bannings don't really work. And as my colleague has said, educating the public about the use of alcohol, educating the public about COVID, educating the public about healthcare issues, transmission, and that we need to protect each other is the long-term goal of how we deal with these issues.
And let me go back to you, Zola. As we, welcome these measures that have been put in place by the President, what do you believe should be done to assist, what more do you believe should be done to assist healthcare workers during this very vulnerable time?
I think the critical task at hand now, and we will replace this to the meeting that we'll be having with the department this evening, is the kind of educational awareness campaign that we must drive. Remember, even frontline workers themselves, they are not clued up with a new variant, its nature and the pace, so they need to be kept abreast in terms of education and training so that they are capable of dealing with any kind of a challenge arising as a result of the COVID-19. So we do think that that's a critical thing and so forth. But secondly, we will also pursue our view that because we are dealing with, exhausted and people who have been working since the 5th of March with COVID, people who have not been sleeping, and in return, there's nothing that really motivates them to triple their efforts. So we'll continue to talk to government to say that can't we find a way that would make the energy re-energize of the health workers in a form of an incentive as part of appreciating the efforts that they put in place, including sacrificing their lives in favor of the nation. So we'll have to find ways that we'll have to incentivize the health workers as part of encouragement to do more than what they are doing now. But also, we'll have also to engage government in terms of the filling of vacant posts, because it's quite clear that frontline workers, as and when they are doing their work, they contract the virus, and they ought to be isolated, or they ought to be quarantined, and as such they will have a serious problem in terms of the personnel that we will have with the numbers coming in and going out of hospital. So we want to really engage the consideration of reinforcing the kind of personnel we have, including ensuring that community health workers, which are critical at this point, are absorbed.
Dr. Letlape, just wrapping things up with you, there has been some criticism as politicians speak about how the vaccine should be used at this stage in time, that a lockdown wasn't necessarily the greatest idea. And one doctor has said that it's quite important for politicians to have a full understanding on the issues involved in vaccine procurement and distribution, and criticizing politicians, saying they don't seem to have the basic knowledge to hold government accountable. What is this knowledge that is required of politicians and opposition parties who are weighing in this morning as the president made the announcement last night?
I'm not too sure what the political angle would be in relation to vaccines. All that needs to be done is that we need to fast track our program of registering the vaccines and making them available. I think waiting for the second quarter is a bit late. The earlier we do it, the better. So what is important is to mobilize the resources. United politicians donated 10% of their salaries towards the fund to make sure that we can bring vaccines. That would be a greater intervention than political speak. What we need to accelerate is to ensure that the sooner we get the vaccines to the frontline workers, the better for all of us. And just to reiterate the importance of adequate human resources. There should be no post in the public sector, particularly in relation to those that provide care, that is not filled. We need to mobilize those resources. And what politicians should be doing is to be ensuring that they are mobilizing funds so that unfunded posts can be funded, posts that are frozen can be unfrozen, and that we accelerate the access to vaccines and making vaccines available to the frontline workers. It is not like the vaccines have not been developed. They are developed. They are already made available in the US. They are already available in the UK. Mexico already has its own pipelines in terms of supplying them. We have a plan, but it might be advisable. It will be a great New Year's present if we could accelerate those plans and make those vaccines available sooner rather than later.
Very well. Thank you so much, gentlemen, for your time. Wrapping things up there, Dr. Kgosi Letlape, as well as earlier on speaking to NEHAWU's Zola Saphetha about the health workers' reaction to the adjusted level 3 of the lockdown.